अस्सलाम वालेकुम व्यूअर्स, चैनल 6 की तरफ से आपका मेज़बान डॉक्टर मोहम्मद अफ़ान कैसर आपकी खिदमत में हाजिर है। पाकिस्तान में मेडिकल ट्रेनिंग इनिशिएटिव का नाम जो है डॉक्टर्स में बहुत ज़्यादा फेमस है। उसके पीछे जो रूह रवां लोग हैं वो मेरे सामने साथ बैठे हैं। प्रोफेसर डॉक्टर आमिर गफूर साहब हैं, एडवाइज़र है रॉयल कॉलेज लंदन के, और इसके साथ साथ ये चेयर करते हैं, डीन है गैस्ट्रोएंटरोलॉजी हेपेटोलॉजी के शोबे के LRH पेशावर में। साथ मेरे मौजूद हैं डॉक्टर पीटर न्यूमन, कंसल्टेंट न्यूरोलॉजिस्ट हैं, लेकिन ये डायरेक्टर है MTI प्रोग्राम के मेडिकल ट्रेनिंग इनिशिएटिव के। वेलकम सर।
थैंक यू।
वेलकम सर।
Thank you very much.
पहला सवाल मैं सर, फर्स्ट क्वेश्चन आई वुड लाइक टू आस्क यू दैट यू आर एन एडवाइजर ऑफ रॉयल कॉलेज लंदन. MRCP exams are very famous in Pakistan, and many people are now don't know, due to some uncertain reasons they are running out of Pakistan, and the only source is the welcoming source is the NHS Royal College. What would you say on this?
Yeah, I mean, obviously, we are interested in training our boys, the Royal Colleges. You must realize that the MRCP exam is a federation, so it's not one college. The 3 colleges are involved, and all the colleges have the same say. So, Royal College of London, Royal College of Edinburgh, and Royal College of Glasgow. So, these are the 3 colleges which make federation, and it's a global exam. I think Peter will correct me that it's done in 36 countries. Places like Khartoum, places like Cairo, Kuwait, Middle East, other places, Sri Lanka. And my colleagues are very keen to help us out, and we are working on it, and in due course we are very hopeful, and it's really to help our boys to maintain and compete at international level, because there's no better exam in the world than MRCP, and that's been proven. In fact, America has taken our director to help them out to initiate, to administer their exams and streamline it. And the MRCP exam is globally recognized because it's constantly being updated and checked, and people like Dr. Peter Newman, who have a tremendous amount of experience, take part in it, and it's all voluntary. So for them to take their precious time, leave their families and their work and help with that exam makes it great that way, and it's purely clinical. You would see that that's the beauty of exam, and the exam is administered to make sure that doctors practice well, because patient welfare and patient care is what we are all involved in, and that's the beauty of it.
Dr. Peter Newman, you're a neurologist, so you understand neurology better. Especially neurologists are also related to some psyche of the Middle East. The people working here, they are very keen to go and work there. What is MTI? How you see the people, because they are very intelligent people, but you can better comment on it.
Yes, well, the MTI scheme is administered by the Royal College of Physicians of London. We have at any one time more than 300 doctors training as physicians in the UK under the MTI scheme. It's come about because it's no longer easy for doctors, international medical graduates from outside of the UK to access training posts within the UK. So the Medical Training Initiative scheme was set up to counter that deficiency. Perhaps the main mission of the Royal College of Physicians is in developing and promoting excellence in medicine, and of course postgraduate training and postgraduate development is a major part of that. So we're not only devoted to postgraduate training for UK doctors, but it's an international responsibility of the college to be involved in postgraduate training for international medical graduates as well. So the MTI scheme, the main components of it are the requirement for doctors who enter into the training scheme to have passed the English language test, IELTS or the OET test.
Because I'm having great difficulty in passing IELTS, especially the Indian and Pakistani. I would also like to take a comment on it.
It's a tough exam. I believe if I were to sit it, I would have great difficulty passing it as well. So I take my hat off to doctors from other countries who pass it. It is a difficult exam, but it is a requirement of the General Medical Council in the UK for practicing in England in the UK within the MTI scheme to have passed the exam. So the only way of doing that is to practice. And
सर आप बेहतर समझते हैं पाकिस्तानियों की लैंग्वेज बैरियर्स को और उन सबको, आप OET या IELTS में से MTA के लिए किस एग्जाम को बैठते हैं?
देखिए ऐसा है कि IELTS is not requirement of the Royal Colleges. IELTS is requirement of General Medical Council, and you could see why. Because you see, when the Royal College says that Affan is trained enough, we can comment on his medical knowledge, your medical skill. But because GMC is concerned about the local patient's welfare, so they want an independent body, because medicine, modern medicine, no matter how much it advances, still stays on the principles of you have to take a history, and history is all about communication. So the local people should be understood, and that is why IELTS is required. Not that Royal College wants; it's just a General Medical Council requirement. So my own feeling is that there is a new component of English language which is called OET. OET is Occupational Employment Test. Some people we've seen recently, candidates who've sat it. Luckily, I haven't had to sit either of them. Otherwise, as Peter says, I'm sure I would be struggling to pass in 7.5. But OET is also coming up, so the boys can choose whichever they want to do. But rest assured, it's not something we've suggested. It is the General Medical Council requirement. Like Pakistan will have a requirement that boys should do FCPS, and that is what we would have to abide by, and we encourage boys to do FCPS. Similarly, Home Office would require you to get a visa to get into a country, so you just have to abide by that. So I sympathize, but people do pass. I mean, we examined, took interviews, and the boys like you who sat it had passed these exams.
Dr. Peter, I would like to take a comment on the interviews. You are here in Islamabad for 2 days. You are conducting interviews of MTI. Then the people are chosen. What sort of benefits people? Obviously, the people from here are going there. They are contributing in NHS. What benefits the doctors of Pakistan are getting if they work under the MTI program in UK?
Thank you. Perhaps the first thing I should say is that the MTI scheme and the training post in the UK are very much complementary and very much not in conflict with the excellent training programs and training schemes that doctors go through here in Pakistan. So the purpose of the MTI training posts is to give trainees the opportunity of developing additional skills, and particularly in some of the major specialties in medicine, such as cardiology, gastroenterology, neurology, etc., where in the UK we're able to offer particular aspects of training, which is helpful for doctors in Pakistan and elsewhere in their future careers, and to improve the quality of care that they could give to their patients in the future. But I'd say again that it's very much it's not an alternative to local training here in Pakistan. It's very much complementary and fitting in with the training programs that doctors have already been involved in and will likely continue to be involved in when they return from the UK.
Thank you, Dr. Peter and Professor Amir Ghafoor. ये MTI प्रोग्राम है जिसके ज़रिए बरतानिया से लोग जो है वो पाकिस्तानी डॉक्टर बाहर जाते हैं, ट्रेनिंग करते हैं, फिर वापस आते हैं, और बहुत सारे लोग उन्हीं के ट्रेनिंग सेटअप्स में एंटर हो जाते हैं. एंड द ग्रेट मैन सिटिंग असाइड मी are the prime reason are facilitating the people from this region. यहाँ के लोगों को फैसिलिटेट करके वहाँ लेके जा रहे हैं, वो ट्रेनिंग करके वापस आते हैं पाकिस्तान की हेल्थ केयर सिस्टम में, अपना हिस्सा बटाते हैं और बेहतर एहसन तरीके से बटाते हैं. डॉक्टर मोहम्मद अफान कैसर, चैनल 6 साइनिंग ऑफ.